case history is basically sitting down with your clients at the beginning of a massage, just before you give them a massage, sitting down with your client and having a chat with them. And it's a specific kind of conversation that you're having. And so I use that word chat because I think it evokes some sort of relaxation. It evokes that when we sit down and have a chat with somebody. And that's what we're trying to do. We're trying to kind of like put people at ease. But we're also wanting to gather some really crucial information that's going to help to inform us and give them the best massage that we can. And we need to rule out those contraindications that might mean that we don't actually massage, or to figure out whether there are some contraindications that we need to take into account that are going to mean that our massage will be tailored to their needs. Because I'm, personally as a massage therapist, interested in working in the field of mental ill health. It's easy to actually talk about a justification for massage treatment if it's physical. It's easy to say, that my client's got long-term back issues, and it's a kind of clear rationale for giving them a massage during this time. But you're less able to, or at least it's more difficult to kind of like look at rationales where mental ill health is concerned, because as we're not in the sort of the role of diagnosing, we're not going to say somebody's got this sort of mental health condition versus this sort of mental health condition, but we might actually acknowledge that people are living in stressful times, and that's affecting them mentally as well as physically. You would need to make explicit that massage or the treatment you give is a critical component of the client's healthcare, i.e. to recognise that without regular appointments, the consequences would be a deterioration in the client's mental health. So has anybody got any questions about that?
Yeah, is anyone working at the moment with, well, not in pre-COVID times, was anyone working with mental health?
Pre-COVID?
Yeah.
Yeah, absolutely. Yeah. And before we realised that level 4 practitioners were going to be able to continue during this time, my colleague in London, Drew Steiner, had let everybody know that he was working in a recovery centre, working with addiction, across the board. And the doctor that was also in that centre had said that even if he wasn't allowed to practice, the doctor still wanted him to practice, because it was, I'm sure you know this, but these times are having just such a great effect on people's mental health that, a massage is such a kind of supreme treatment for people who are experiencing all range of mental health issues, serious as well as not so serious.
Useful to know that people are being referred for those kind of conditions.
Absolutely. It's kind of high on the priority list as far as I can see. Massage therapists working with mental health, definitely. And then there was Britney Spears, before actually she was diagnosed with mental health. She's got, I think they've diagnosed her with, is it bipolar? Britney Spears. And then there was Will Young. Yeah, so you can't tell by looking at a person whether they've got mental illness or not. So that's why I want to focus on that today. And I want you to just kind of reflect on this and examine your attitude. It's like your immediate response when you consider working with somebody with mental health issues. And I want you to have a little think of 4 mental health conditions. Yeah, so I'm putting you in pairs. and I'd like you to talk about your response, your genuine thoughts to working with somebody that's got mental illness. So you met in your pair and you had a little talk about what your response might be if you were working with somebody that's got a mental health issue. Do a few of you want to sort of share what came out of your discussion? Anybody that maybe hasn't spoken yet?
I think at first you feel a bit apprehensive because you don't know what kind of mental health illness is it. So I think you just have to find out what kind of mental health illness is it, if the patient is medicated, how bad is it, and just do some more research about it if you're not sure.
Yeah, good point.
And obviously, if it's one-to-one massage, then obviously you'll be a bit scared about that. So
you might be, yeah.
Yeah.
So you need to check your fearometer, don't you, and find out whether actually you're feeling too scared to massage, or whether it's enough to have a chat with them and find out what their experience of their mental ill health is. How does it affect them? Because that's a really good question, I think. How does it affect you? And then decide whether you're going to go ahead with the massage or, like you say, do some further research.
Yeah.
Good job.
Okay, can you get in touch with the doctor if there aren't any, or it doesn't really...
You can try. I mean, you have to have their permission to be able to do that. But usually doctors are very busy, and it would be rare. I mean, I think they're better these days, but it would be rare for them to engage with a massage therapist.
So how does it happen? Is it client contacts you that he wants the massage because of his mental health illness, or they just coming to you and then it comes out when you're having a discussion?
Yes, it's more likely that it'll be that, Dorota, that it comes out when you're having a discussion with them.
Yeah. So then you just decide whatever you want to do it or not. So.
Yeah. That's right. Yeah. So we're all pretty cool, yeah? Okay, so we're just going to dig down a little bit more into this case history process.